But now I want to turn it over to Abigail Toompe, who is the Associate Director for Communication Science, Center for Surveillance, Epidemiology, and Laboratory Services at CDC, and let her say some final words as we wrap up. Abigail?
Thank you so much, Sandra. And thank you all for the opportunity to speak with you today to close out your workshop. All of us at CDC are deeply appreciative of the National Academies of Science, Engineering, and Medicine for your partnership and pulling off this important workshop. We appreciate that all of you took time out of your busy schedules to contribute to these discussions. And over the last 2 days, we've heard you grapple with the difficult issues that public health and our partners have been dealing with for the past 2 years. Trust and trustworthiness, credibility and confidence, mis and disinformation, to name a few. For the past 2 years, I've been working as part of CDC's COVID-19 response. And for the past year, I've had the tremendous honor of serving as the Acting Associate Director for Communication for CDC, where I oversaw all agency-wide communication, and in particular, our communication efforts for the COVID-19 response. Like many of you, I've spent many hours, days, weeks, even months thinking through some of the issues that you all have been discussing the last couple of days. And I have spoken with many of you directly about how we can build and restore trust in public health. This workshop could not be more timely. Now is our time to take a moment and reflect on what we've accomplished, what we've learned, and prepare for the next phase of our nation's response to COVID-19 pandemic or whatever may come next. Today, in the few minutes that I have with you, I want to tell you about some of the things we're doing at CDC to tackle these issues. And I want to tell you about some of the stories and people behind CDC's work to build and restore trust in public health. But first, I want to acknowledge what we've been through. Building and maintaining trust requires that as a basic function, you have what is most critical in a public health response, and that is your voice. And during the challenges we faced in the first year of the pandemic and getting our voice and our messages out to the American people, we used our science and our evidence as our voice. From the early days of the pandemic, misconception and misinformation were drowning out sources of trusted information. But through that noise, one signal broke through again and again, thrusting the science of COVID-19 into the national conversation. And that is CDC's Morbidity Mortality Weekly Report, or MMWR. Often referred to as the voice of CDC, MMWR has published a COVID-19 report on average every 48 hours since the start of the pandemic, laying the foundation of what we know about this virus. MMWR's role as the pandemic source of scientific truth is not by accident or happenstance. It's because of a multidisciplinary editorial and communication team, all under the tenacious leadership of MMWR's editor-in-chief, Dr. Charlotte Kent. MMWR's stream of scientific reports have shaped national headlines. They've sparked dinner table conversations about staying safe in uncertain times. And they documented unforgettable moments throughout the pandemic. Who could forget a catastrophic choir practice in Washington State, the explosive spread in a children's overnight camp in Georgia, a Maine wedding with tragic consequences, the squelching of a spike in Arizona after a mask mandate, and the first documentation of virus transmission in vaccinated individuals caused by the Delta variant in Massachusetts. MMWR published the earliest descriptions of asymptomatic transmission and illuminated the disparate impact of COVID-19 on racial and ethnic minorities. In short, they have told the American public the who, what, where, when, and how of this national crisis. Building and maintaining trust also requires that trusted partners are using their voice in unison, and Sandra just said this so well. In 2020, CDC's Dr. Peggy Honane joined the COVID-19 response to stand up our task force focused on state, local, territorial, and tribal coordination. Through Dr. Hunane's efforts and the efforts of many staff from around CDC, they were able to assist public health departments from the early days of the pandemic and learned from these on-the-ground experiences to improve and inform our national response efforts. In the summer of 2021, Dr. Hunane was part of the leadership team in CDC's COVID-19 response that was pondering a new issue, the Delta variant. It was clear that something was different about Delta, and we were faced with the difficult communication message of telling the American people it was time to put their masks back on again. Dr. Hunane knew that getting the message that resonated was critically important and that it was going to take feedback from local public health officials to get this right. After seeing the initial data on a Friday night, Dr. Hunane assembled a team of scientists and communication experts who worked throughout the weekend, that July weekend, and she held focus groups, in-depth data discussions with public health officials in states that were seeing initial surges in COVID-19 cases caused by the Delta variant. And she positioned the agency to be ready to announce by Tuesday, a mere 5 days later, the news to America that it was time to put your mask back on again. So in just 5 days from seeing initial data to confirming the analysis over the weekend to announcing the news, Dr. Hunane knew our primary mantra of risk communication: be first, be right, be credible. Building on Dr. Hunane's work, we've strengthened our partnership and coordination with communication experts and public health officials at state and local health departments, both in advance of guidance releases to ensure that the guidance is feasible when implemented, and as situations are evolving to ensure consistent messaging advice is provided. This partnership proved critical during the initial cases of Omicron in the United States. In several instances, we were able to orchestrate simultaneous announcements from a county health official, a governor, and the White House press secretary, Jen Psaki, to announce initial cases of Omicron and to instill calm during a time that was yet another uncertain moment. Utilizing our collective voices in unison is not only critical for COVID-19, but will be critical for public health crises and emergencies moving forward. Building and maintaining trust also requires rapid action to squash misinformation, and you all have been talking about this a lot. Under the leadership of many talented health communicators at CDC, we have been working to ensure the public can receive factual information on COVID-19 and other health topics. We have employed social listening to better understand misinformation and have conducted regular message testing strategies to keep a pulse on what Americans are feeling at each stage of the pandemic. This work has allowed us to audience segment people based on which public health recommendation they follow. And as you all have discussed the last couple of days, it is not always uniform. We have educated tech platforms on scientific and health facts so they can better monitor misinformation on their platforms. Additionally, under the leadership of Carol Crawford, who is CDC's digital lead, we've undertaken a 4-year digital modernization initiative to strengthen digital health communication across CDC for both emergencies and non-emergencies, so we can better address public health messaging needs now and into the future. Building and maintaining trust also requires that we are thoughtful and inclusive in our language. The pandemic laid bare to the hard truth of health equity in this country. Individuals and communities that have been marginalized have been disproportionately affected by the pandemic. The results of these inequities will have devastating impact for years to come. Dr. Leandris LaBird of CDC recognized that CDC needed to do better and transform our words into action. In 2020, Dr. LaBird was brought in as the Chief Health Equity Officer for CDC's COVID-19 response, where she assembled a multidisciplinary team to address equity in all of our efforts. This team developed a suite of communication resources known as CDC's Health Equity Guiding Principles for Inclusive Communications, which are intended to help public health professionals, particularly health communicators, within and outside CDC, ensure that their communication products and strategies adapt to the specific cultural, linguistic, environmental, and historical situation of each population and audience of focus. But we need more than just words to build trust. We also recognize that in order to build and maintain trust, we need, as you guys have discussed, a public health workforce that reflects the diversity of the communities we serve. And then we need to upskill them so they can serve in jobs ranging from community health workers to genomic epidemiologists to risk communication experts. CDC has partnered with AmeriCorps to launch Public Health AmeriCorps, a new pathway program to recruit, train, and develop the next generation of public health leaders representing the communities they serve. We have a new $3 billion grant program to build the public health workforce, offering state and local health departments funding to move from their urgent short-term goals to a sustainable forward-facing approach. After declaring racism as a public health threat in 2021, we, along with over 200 state and local health departments who joined us, have recommitted ourselves to the work of addressing the structural factors that deeply impact the health of the communities we live in. Health equity must be at the core of everything we do. It's in our actions and our leadership together that will make a difference. So we still have a lot of work to do, and certainly we know that. And we have a lot of lessons to learn and take away from the last 2 years. Our communication landscape is constantly evolving. Conversations about data and science that once happened within the walls of scientific meetings are now happening on TV and on Twitter. And the pandemic and the science and the public health threat at the moment is constantly evolving. As hard as it is, we need to convey that the science is not static, and that truly each day we learn more, and consequently, our guidance may need to be updated. We have the difficult job of using the science and data to provide more tailored recommendations so people can make the choice that is right for them, their family, and their situation. But that means more nuanced messaging and the continued challenge of making our language clear, equitable, inclusive, and accessible. So every day I know you face similar challenges in your work. And in closing, I want to say, we need all of you to continue helping us build, restore, and maintain trust in public health. You can help us communicate the science. You can help us by using your voice in unison with us. You can help us promote public health recommendations, and you can help us in your continued partnership. So thank you for your time and commitment these past 2 days. Thank you for your partnership, and thank you for your continued commitment to the American people. So Sandra, with that, I'd like to turn it back over to you.
Thank you, Abigail. And just a thanks to you and your colleagues. I know these 2 years have been just endless work and under challenging circumstances at times. So I just want to thank you. And for our participants, our panelists, our moderators, the planning committee, I want to thank you for just putting together an amazing 2 days. So with that, we are officially adjourned.